Autoimmune disease is an epidemic by any measure in the United States and in many Western nations around the world. And what we see in the United States today is really an explosion in recent years of autoimmune disease. There are over 155 known autoimmune conditions. The United States has the highest incidence per capita of any nation on earth. The estimate now is it's about 1 in 5 Americans, about 20% of the whole country, has one or more autoimmune conditions. And that's more than double the average in other developed nations, which is about 1 in 10. The United States, I believe conservatively, is 1 in 5. It might be higher than that. So we need to understand that all disease eventually becomes autoimmune, and that autoimmune conditions tend to be additive. So when a person gets one, say Hashimoto's disease, they'll tend to develop another, say Sjogren's or MS. When you have one autoimmune disease, you're more likely to get others. So what to do? This is very significant because autoimmune diseases can be very debilitating, can be very painful, and can definitely inhibit quality of life, and can contribute to a range of other conditions. So what we need to understand first are the causes of autoimmune disease. And once you understand the cause, then you can implement the prevention of autoimmune disease and also the correction. So what I wanted to mention today, in addition, is some of the contributors to autoimmune disease. And once we understand these, we can try to avoid them and then reduce the likelihood that a person will develop an autoimmune disease. And if they have one, maybe not develop additional ones. So there's a couple of key contributors that I would cause. In holistic medicine, we don't really look at single causes as much as contributing factors. And one of the main contributing factors to the explosion in autoimmune disease these days is the current vaccine schedule. It is very well known, extremely well established in the current scientific literature of the past few decades that vaccines definitely, absolutely, directly cause autoimmune disease in certain people. And this, is a really tragic trade-off of a few perhaps mild, self-limiting, non-dangerous, non-fatal infections, trading those for chronic, debilitating, long-term illness in the form of autoimmune disease. So that's one thing. And the mechanism, there are several mechanisms that have been elucidated in the science, and there's even a medical textbook called Vaccines and Autoimmunity, looking at the current state of the evidence. And it appears that one of the main mechanisms, and there are several, but one I wanted to mention today, is the chronic immune stimulation, the chronic immune activation caused by the vaccine adjuvants like aluminum, or even worse, squalene. And these adjuvants are designed to put the immune system in a state of heightened alertness. So this causes the breakdown of immunological tolerance, and the body will, antibodies will tend to cross-react with body tissues in that state of chronic immune alertness, or danger, as we say. So that's one thing. Another thing is the leaky gut. And the leaky gut is a very common, or intestinal hyperpermeability is a condition where undigested proteins and other things, infections, all kinds of things will enter the bloodstream through a pockmarked, we could say, or hyperpermeable leaky gut membrane. And this definitely will contribute to and cause autoimmune disease as well, through the action of the immune system, kind of finishing the job of digestion. You don't want your immune system completing the job of digesting your lunch, but that's exactly what happens in a leaky gut. And this will lead to, again, cross-reactivity of antibodies to your foods, cross-reacting with body cells, which then get attacked as a result. That's one of the mechanisms there. So vaccines, leaky gut. The third area is a weakened innate immune system is another major factor from stress, nutritional deficiencies. The body's immune system or immune resistance becomes weak. The cells become weak, more susceptible to infection. And then a lot of people are walking around, I would say most, from my 30 years of practice, can say most people are walking around with some degree of low-level infection, whether it's viral, bacterial, fungal, or parasitic. And this also can contribute to or directly cause certain autoimmune diseases. So we've got a serious situation here. And as practitioners, we really need to understand all of the causes and mechanisms of autoimmunity, as we or the major ones at least, so that we can address these in our patients and prevent people from going down the autoimmune continuum, and also supporting patients in a way that they can actually reverse their autoimmune condition, which is very, very possible, which I've seen countless times in my 30 years of practice, and my students in 27 years of teaching have seen this with many thousands of patients over the years. And so it's very, very doable. You just need some specific training in this area. And so it's very important that we get skilled in this area, because unless we are skilled as practitioners or even a health conscious patient in working with autoimmune conditions, then we're really not going to be able to fully help the modern patient. So to learn more, please go to autoimmune-mastery-program.com, also accessible through michaelgaeta.com, which is the website of the Gaeta Institute for Holistic Health Education. Again, autoimmune-mastery-program.com. I'm Dr. Michael Gaeta. Thanks for listening today. I hope I provided some useful insights for you. And please comment and share based on what you've learned today. So thanks for listening, and be well.